Thank you for calling 211 Texas. To continue in English, press 1. If this is a medical emergency, please hang up and dial 911. You have reached 211 Texas. There are several options you can choose. You picked the option to get help with state benefit programs. I'm your virtual agent and can give you information and help you complete certain tasks. Please tell me how I can help you today. If you want to hear a list of topics I can help you with, say topics.
Topic.
You can say any of the following things that we can help you with. Apply for benefits. Information about benefit programs. Check benefit status. Missing information or documents received. Report a change. Request a form or application. Find a benefit office. Help with your Texas benefits, including your username, password, or with the website or mobile app. Lone Star Card. Report fraud. Form H3038 for providers. Pick a healthcare plan or provider. Pay chip premium. WIC program. Get a phone number for other benefits or services. File a complaint.
Medicaid.
Medicaid and the Children's Health Insurance Program, or CHIP, provide health coverage for low-income children, families, seniors, and people with disabilities. In some cases, Medicaid can pay for past due medical bills. The best way to learn more about our programs and to apply or renew benefits is to visit our website, yourtexasbenefits.com. Would you like to apply for this state program, or are you calling to get help or services in your community? Thank you for holding, and I appreciate your patience. Are you still here with me?
Yes, ma'am.
All right, thank you. Let me verify just a couple other items, please, if you don't mind. What is your address, both physical and mailing, and also your phone number, please?
Okay. 8218.
Thank you for that moment of silence. I appreciate that. Sir, are you still here with me?
Yes, ma'am.
All right, thank you. So I wanted to let you know the reason why I wasn't pulling up any information prior is because you had provided the last name Win,
Right.
and my system is showing the last name Pham. Is there a correct one, or are they both correct?
No.
Or could you give me some insight?
No. Fam. Fam is the right one. H
Okay,
O
okay.
H O A N and VAN and PHAM.
Okay, got it. Thank you so much. And so, just so you're aware, again, that's why I couldn't find anything initially. Don't be
Sorry.
alarmed when I said I
Sorry.
couldn't find anything, okay? It's
I'm
just there was
sorry.
nothing coming up with what you provided, but I'm in now. So did I hear you correctly, Mr. Pham, that you had said that you're needing a Medicaid card, that you never received one?
Right.
Is that correct?
Yes, ma'am. It is correct.
Okay. Okay, thank you so much. I appreciate that. All right, so what I'm going to do is let me take a look and see if there's any Medicaid programs that you're active on where you would get your Texas Benefits Medicaid card.
Okay.
There are some programs where you don't get a card, some you do. So let me
Oh.
confirm where we're at with that.
Oh,
May I
see.
place you on another brief hold? I will
Okay.
come back in a moment.
Yes, yes, yes. Okay, thank you, thank you.
Yes, sir. Thank you for holding. I appreciate your patience. Mr. Pham, are you still here with me?
Yes.
Thank you so much, sir. I appreciate that. So, Mr. Pham, I'm not showing that there is a Medicaid card generated because I don't see a program that is approved where you would get a Medicaid card.
Well,
When the last...
well,
Go ahead. I'm so sorry. Go ahead and speak, sir. I'm so sorry. I didn't mean to speak over you.
I'm sorry. Okay, the reason I tell you because I have the Medicaid number. That's why I wonder maybe it's lost or I don't know.
Sure. Okay, so just to let you know that any time that you apply for benefits, you're going to be given, I guess for lack of a better word, a system number that's called an individual number,
Yes.
A member number, and if you have Medicaid, it would be your Medicaid ID number.
I see.
But everyone's got this number, whether they have Medicaid or not, when they apply for benefits.
I see.
Right now, I don't see an approved Medicaid program. I saw that you had submitted an application and applied back in August, but I don't see that there's an approval for the program yet. If you would like, let me check and see if I can confirm
what the status of that application is. You may already know and may not have any questions about it. But that's why you haven't gotten a Medicaid card, is because you don't have an approved Medicaid program.
I see. I see. Okay, let me ask you this. Right now, I'm a disability, but I don't have the doctor. I don't have medicine, no pharmacy. So I really need
Right.
help. So what should I do?
Okay. Well, let me take a look at a couple things on the case. Sometimes HHSC, the agency that processed that application, they'll put additional information where I would be able to provide you better direction on this, okay?
Good, good, good,
Um,
good.
Thank you. Well, with your permission, let me check that. May I
Okay,
place you on a brief hold? I'll
okay.
come back in a moment.
Thank you.
Thank you for holding. I appreciate your patience. Are you still here with me?
Yes, ma'am.
Thank you. So, Mr. Pham, there may have been some changes that have happened since you actually submitted that application back in August, okay?
Yes.
Do you get Medicare now, or is it still too early for you to get Medicare?
No, I don't have a Medicare.
Okay, don't have Medicare yet, okay?
Right.
So, when you submitted the application in August, Health and Human Services, who processes the applications that were listed on there, they reviewed you, said, okay, right now he doesn't qualify for anything because he doesn't have Medicare, and they couldn't do anything else with the other programs that were listed on the application. Now, also on that application, there was a request for the agency with Health and Human Services. It's called the Department of Medical and Social Services. They were directed to check for medical need for any of the long-term care programs. And so what that means is that when you're applying for these programs, this division will contact you. They'll take a look and confirm, do you have medical need or a need for the services that they can hook you up with? And once they're done reviewing your situation, they'll send that information over to Health and Human Services to put you on the program they want you on. That hasn't happened yet. Have you spoken with someone, either Health and Human Services, DADS, or Department of Medical and Social Services?
No, I don't know
Okay.
anything, and I don't
Okay.
know how to
I
do.
know it's very confusing because you have a hard time identifying who you're actually speaking with. Okay,
I see.
I understand.
Hmm.
So basically, in this situation, with that request for you to be reviewed for long-term care, we have not gotten a response from that division. So what I am going to do is I'm going to give you their contact phone number. I can't transfer you there, but I can give you information on how you can contact them. And then when you contact them, I'll give you some, information in regards to what you would ask them.
Okay.
Okay?
Okay.
All right.
Mm.
So if you can grab a pen so you could make a couple notes, please.
Yes. Go ahead.
Okay. So the division that processes long-term care programs for you, like community attended or the Star Plus waiver program, you can kind of make note. They've got a lot of programs that they review.
Yes.
Okay?
Mm-hmm.
I don't know which program that they would put you on. They have to contact you and review your situation and your medical need for services.
Mm-hmm.
Okay?
Mm-hmm.
And so since it doesn't sound like they've contacted you yet, I don't know what their process is. I don't know if maybe they tried to call you and they weren't able to reach you. Maybe there's just a delay because you're further back in line.
Mm-hmm.
And so they're going to be the ones to talk to you, or you're going to be having to speak with them about where are we at in this process for my request for additional help.
Okay.
Okay?
Mm-hmm.
Their phone number is 1-855-937-2372.
Who are they?
Health and Human Services.
I saw health and human service all over. Everywhere is
Yes,
health and human service.
yes,
So I don't know which
yeah.
one
See,
is
there's
which.
yeah, no, that's okay. It's all right. I understand because when you speak with me, I'm with the Informational Call Center for Health and Human Services Commission. A little bit different.
Oh,
And so, Health and Human Services, they've got different agencies that fall under their umbrella, including Health and Human Services Commission. This is why it can be very confusing.
very, very.
You are fine. I can understand you perfectly.
Thank you very much.
Seriously, you have wonderful English.
Oh my
Wonderful
goodness.
English.
You are the first one to tell me that.
No,
Okay.
I can understand you perfectly.
Uh,
So this agency that I'm referring you to.
okay, so I should call them. By the way, someone tell me I need the case worker. Should I need the case worker?
Thanks. So when you're trying to get this help, there's no caseworker that I can direct you to currently because that division, the Division of Health and Human Services, has not reviewed your need for medical services. So they have to take a look at your situation and decide we need him on, and they'll tell us what program they want you on.
Oh,
They'll refer or send this information over to us, and it will be processed. We
see.
haven't gotten this information.
I
So
see.
when you call this 855 number that I gave you,
Yes.
let them know that you've been applied for long-term care programs.
Oh, okay.
Okay?
Okay.
You can mention programs like the Star Plus Waiver Program. They do medical and also other services. But let them know you applied back in August and you still haven't been reviewed for your medical need for services
Okay.
and that I need help.
Okay. Okay.
Okay?
Okay. Okay.
So, and make sure that they're aware you applied back in August.
Okay,
So
okay.
that way they're aware this is not something where you're starting from square one.
Oh,
We don't
okay.
have anything from them, and you applied a number of months ago.
Okay. 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 I think I understand about 60-70% of your information, but I go from there. Again, thank you very much for your help, and I think you are big
My
help.
pleasure.
Okay?
Thank you.
Thank
And I
you.
hope I've answered all your questions today, sir. Thank you for calling HHSC. Goodbye, and you have a great day.
Thank you very much. See you.